The top stories tonight in Y News. The health department is monitoring more than 400 different areas in the country with clustering of COVID-19 cases.
The Philippine government to further boost its testing, tracing, and treatment strategy to contain the COVID-19 outbreak.
LRT2 removes ticket sellers from its train stations.
Malacanang allays the public's fear of China's bubonic plague.
Great Britain's finance minister says that he can't promise all furloughed employees could return to their jobs.
And balloon internet service flies high over Kenya.
Good evening, Philippines and the world. Today is Thursday, July 9, 2020. Join us in the next hour as we deliver today's top stories around the globe. I am William Theo.
We are also seen in 1,935 satellite monitoring centers nationwide and via live streaming worldwide through the UNTV News and Rescue social media accounts and our website, untvweb.com. I'm Angelo Castro III.
First in the news, the Department of Health areas nationwide of the coronavirus, 50,000 parts. Joining us tonight is our health correspondent, Aiko Miguel. Aiko?
Yes, William, the Department of Health has monitored 488 clustering of cases of coronavirus infection in different areas nationwide. This means active transmission of COVID-19 is evident in such areas. As of July 9, William, according to DOH, there are 379 clusters in communities, 46 in health facilities, 24 in jail, and 39 in other areas. It also appears that there is a clustering in MRT, in a construction site within Metro Manila, and in barangays in various parts of the country. There are also new clusters of 6 barangays in National Capital Region, one barangay in Cebu City, 1 barangay in Mandaue City, 1 barangay in Palawan, and 1 barangay in Albay. According to the DOH, the spike of COVID-19 cases in the country is not only attributed to the expanded testing capacity, but also to active transmission. For instance, in Metro Manila, William, there are more cases reported because of more relaxed community quarantine, in which people are allowed to go back to their workplaces, and public transport has resumed all throughout the limit, although with a limited capacity. Here is Undersecretary Maria Rosario Vergere.
Maaring ang pagtaas ng mga kaso sa Metro Manila ay dahil sa increased testing capacity and community transmission na ating nararanasan nang simulan natin ang pag-ease ng community restrictions. Lalong na pag-igting ang community transmission kung lax o hindi natin sinusunod ang minimum public health standards.
William, the DOH is continuously monitoring and guarding areas with possible clustering. The Health Department continues to remind the public of the minimum health standards to prevent cases from ballooning to more than 100,000 by the end of August. Here is Undersecretary Vergere.
But we will not stop reminding everyone to wear masks, observe physical distancing, and sanitize. This is our call to everybody, whether you be in the private or public sector. If you are going out and exposing yourself and your loved ones to an unseen enemy, protect yourself. By doing so, you protect your family, you protect your community, and you protect the country.
Meanwhile, William, the country's DOH and the Department of Science and Technology are continuously looking for clinical trials for COVID-19 vaccines in different countries. According to the DOH, they have been monitoring clinical trial phases in other countries, which we could join. Undersecretary Vergeres said there are 21 vaccines undergoing clinical trial and 139 are on their preclinical evaluation stage. The Interagency Task Force for the Management of Emerging Infectious Diseases has given a go signal for the Philippines to collaborate with China and Taiwan for the clinical trials of COVID-19 vaccine candidates. The DOST also said that the Philippines has committed to join the World Health Organization Solidarity Trial for a COVID-19 vaccine, and the WHO may give the Philippines the vaccine for free, according to DOST. William.
Yes, thank you very much, Aiko Miguel, for that report.
Malacanang says the government could have done better if COVID-19 laboratories were set up earlier. Our Malacanang correspondent Rosalie Cos tells us why.
Malacanang was asked today about the government's lapses in responding to the coronavirus outbreak in the country. Presidential spokesperson Harry Roque said the government could have done better if more COVID-19 facilities were established earlier.
So inaamin po natin na medyo naging mabagal yung proseso, na lumipas po ang 2 buwan, iisa lang po yung ating testing facility, RITM. So Marso pa lang tayo nagsimula na magkaroon ng mas marami pang mga laboratories. So if I were to look back and what we could have done better, siguro po nung nagkaroon tayo ng unang kaso na imported case ng COVID, dapat pinalawak na natin yung testing capacity natin kaagad. No?
In January, the Philippines had only one COVID-19 laboratory, but now 78 licensed RT-PCR laboratories all over the country have been established. Also, according to the Palace, to contain the COVID-19 outbreak, the government will further boost the testing, tracing, and treatment strategy.
Lalo po natin papaintingin yung ating T3. Mag-antay lang po tayo sa detalye, pero bukod po doon sa 10 million na na-order na natin at 1 million na na-deliver na PCR testing, magkakaroon po ng mas malawak pang targeted testing na i-anunsyo po natin sa mga darating na panahon. No?
The Duterte administration has also been reiterating the important role of local governments, companies, and private individuals in preventing the spread of the virus by strict adherence to minimum health standards such as wearing a face mask, social distancing, and frequent hand washing. Rosa Licos, UNTV News and Rescue. We serve the people, we give glory to God.
The national government now pushes for a common ordinance among local government units on mandatory wearing of face masks. This was discussed during the meeting of the Interagency Task Force with Metro Manila mayors. Also, this is the response of the palace after a journalist was apprehended in Quezon City for removing his face mask to sip water.
Minungkahin na po na magkaroon ng common ordinance, no, para po magpataw ng parusa sa mga taong hindi nagsusuot ng mask sa mga pampublikong lugar. So magkakaroon po yan ng common ordinance.
If you frequent Agora Market in San Juan City, don't be surprised that it is closed for now after the San Juan City government decided to do so. Agora Market is even considered by the city government as the epicenter of COVID-19 in San Juan. Vincent Arboleda will tell us why.
A fish stall helper at Agora Market in San Juan City tested positive for coronavirus disease 2019 last July 1, and this prompted the local government to temporarily close Agora Market. 647 vendors and employees of the market have all been subjected to swab testing. Of the 614 results released, 23 vendors and employees were found infected with SARS-CoV-2, the virus that causes COVID-19. With this, San Juan Mayor Francis Zamora decided to extend the closure of the market to July 15. Based on the July 8 data released by the San Juan LGU, the number of confirmed COVID-19 cases in San Juan has reached 481, 134 of which are active cases. 300 have recovered, while 47 succumbed to the disease. Based on data from San Juan local government, The number of new COVID-19 cases in the city has been low from June 15 to June 26, but the city experienced a sudden spike of cases on June 27 at 16. The city also experienced a continuous increase in COVID-19 cases starting July 1, the day when the Agora Market was closed after a fish stall helper tested positive. According to San Juan authorities, Agora Market is the epicenter of the recent increase of COVID-19 cases in the city. Authorities conduct disinfection of the market. Agora Market is set to reopen on July 16, but Mayor Zamora says only those who tested negative and with a health clearance from the City Health Office will be allowed to return to work or open their market stalls. Authorities also plan to designate health and safety officials in the area to make sure health protocols are strictly followed. Meanwhile, portions of 2 streets in the city are considered critical zones after several residents of the area tested positive for the virus. 7 individuals at C. Santos Street in Barangay Balong Bato tested positive, while 6 from J. Eustaquio Street in Barangay Progreso were also found to have been infected by COVID-19. The 2 streets are now under a 15-day lockdown from July 7 up to July 22, based on the National Task Force on COVID-19 Memo Circular, which states that if a street has at least 2 COVID-19 cases composed of either confirmed, suspected, and or probable COVID-19 patients staying in different houses or buildings, then it shall be considered as a critical zone. Local government has also started providing food packs to all 255 families affected of the lockdown, while the police and barangay officials make sure that residents stay inside their houses during the lockdown period to prevent further spread of the virus. Vincent Arboleda, UNTV, News and Rescue. We serve the people. We give glory to God.
Meanwhile, couples who want to travel on board a motorcycle as a rider and back rider get a green light from the government. Leia Ilagan tells us why.
The Department of the Interior and local government has allowed motorcycle back riding for couples and common law partners. But DILG spokesperson Undersecretary Jonathan Malaya clarifies that it is a must for such riders to use protective gear like shield between the driver and the back rider, aside from a helmet and a face mask.
Kailangan po ito for safety purposes at for convenience na rin po kasi pwede po itong lagyan ng hawakan. So instead na nakayakap tayo doon sa drivers, dito na po tayo hahawak. So kailangan po solid din ito kahit at naka-bolt or naka-welding doon sa motor para maging safe for both individuals utilizing the motorcycle.
Malaya adds DILG will issue the design of the protective shield to be the pattern for the motorcycle rider.
Parang design. Galing po ito doon sa proposal ni Governor Yap ng Bohol. No? So we will release this to the public. Ito yung po yung magiging guide natin. No? But of course, hindi naman tayo magiging OC, obsessive compulsive na kung kayo ay lumampas ng isang inch or kaya naman hindi na namin papayagan. Ang importante lang po ay more or less sumunod tayo doon sa design na inaprubahan at ito po ay made of solid material.
Those riders must also present an ID and document to prove their relationship should they be screened at checkpoints.
Pwede pong dali nila yung kanilang marriage certificate para po ipakita sa ating kapulisan o kaya naman po ay any government issued ID na nakalagay doon, di ba, sa likod ng mga ID natin nakalagay during emergency, please contact, nakalagay relationship, kailangan nakalagay doon yung pangalan ng ating mister o yung ating misis at nakalagay doon yung address.
Malaya clarifies that other back riders are still prohibited. Violations will face sanctions. Leia Ilagan, UNTV, News and Rescue. We serve the people, we give glory to God.
The tourism sector in Camarines Norte province in the Bicol region is gradually reopening. Department of Tourism has granted authority to operate to a number of restaurants and hotels in the province. According to Provincial Tourism Officer Bong Palma, they also continue to inspect hotels and restaurants to determine if they are compliant with anti-coronavirus health protocols. About 10 hotels have been issued with authority to operate and 14 hotels and restaurants have been granted provisional authority to operate. Some of those establishments have already opened their doors.
And now let's take a closer look at the updated count of coronavirus cases around the world. The COVID-19 pandemic has now reached a total of over 12 million confirmed cases in 188 countries, regions, and sovereignty. The Americas make up more than 6 million of those cases, while Europe has over 2.8 million in total, while Southeast Asia has surpassed 1 million, according to the World Health Organization. The fast-spreading disease has claimed close to 550,000 lives, while almost 6.6 million patients across the globe have recovered from the new coronavirus infection.
Meanwhile, the country's Department of Health says that 1,395 new cases were reported today, including 1,184 fresh ones and 211 late reported. That raises the total confirmed cases of coronavirus infection in the Philippines to 51,754. That is as of 4 p.m. today. There are no deaths reported today. But through our fervent prayers, medical interventions, and sacrifices, our medical frontliners, 225 more people have won their battle against the invisible enemy. That brings the total recoveries nationwide to 12,813. Thanks be to God.
If you are a commuter who uses the Light Rail Transit or LRT Line 2, you might be surprised that queues for train tickets are fast moving and there are no sellers of tickets if you want to buy one. Instead, use the ticket vending machines. Joanne Nano tells us why.
The Department of Transportation is still awaiting the results of swab tests for coronavirus infection of thousands of its employees. As of yesterday, a total of 203 MRT3 personnel have tested positive for COVID-19, including station employees, train drivers, control center personnel, depot workers, and ticket sellers. The DOTR has been able to identify from which stations and working shifts those ticket sellers were deployed. The passengers who might have had physical contact with them are advised to observe their health and to undergo home quarantine. Following this transmission woes, the Light Rail Transit Authority has removed its ticket sellers from all LRT2 stations. Following this transmission woes, the Light Rail Transit Authority has removed its ticket sellers from all LRT2 stations. Instead of physical ticket selling, passengers will have to use the ticket vending machines.
Noong nag-start kami ng operations ng June 1, kasama na talaga sa plano namin na talagang TBM na lang ang selling ng ticket natin. But we cannot do that immediately kasi kailangan nating i-announce. But what we did is to start with the small stations. So if you recall, as early as June 1, nung mga time na yun, in-announce na namin na with the small stations like Gilmore, J. Ruiz, at saka Betigo Belmonte, talagang TBM na ang gagamitin, wala ng teller.
The LRTA clarifies this doesn't mean that ticket sellers are displaced. In fact, they will continue working by assisting senior citizens who want to avail discounts and passengers who might encounter technical issues with their tickets. The LRTA also assures to conduct intensified disinfection in trains, stations, depot, and other facilities as well as on single journey tickets.
At the end of the day, pag nakolekta namin lahat ng single journey ticket, dadalhin namin sa depot. And then, iko-quarantine namin sila for 72 hours. So, by that time, based on sa study, patay na yung virus. Saka pa lang namin sila i-re-encode and then ibabalik ulit sa circulation.
For LRT passengers, using the ticket vending machines is convenient.
Mas convenient po siya. Kasi po, wala na pong pera. So, mas lesser po yung transmission ng virus po sa ngayon. And then, yung pila po, kasi pag yung pera po yung gagamitin is nakapila po siya minsan. So, pag machine po kasi is madami po siyang machine, so mas mabilis po siya.
Napaka-komportable kasi safety po siya, hindi ka na po kailangan may pagsiksikan at pumila.
Mas safe yun kasi hindi magkakahawakan ng contact talaga sa bawat tao.
As of today, 2 office-based LRT2 employees have tested positive for the new coronavirus and are now isolated. Meanwhile, 1 employee of the Philippine National Railways or PNR is a confirmed COVID-19 case, but the PNR assures the employee did not have physical contact with any passengers. The PNR regularly conducts health checkup among its personnel in order to prevent further transmission of the deadly virus.
Swab testing, may protocol po tayong sinusunod dito sa PNR na if ever po dahil po may daily symptoms check tayo na ginagawa, pag may 1 symptom ka doon sa listahan, you have to undergo 3-day quarantine. Then after 3-day quarantine, babalik ka po sa PNR, magpaparapid test ka.
Joanano, UNTV News and Rescue. We serve the people, we give glory to God.
Quezon City residents are expected to wear a face covering in public places within the city at all times. Dante Amento reports why.
The Quezon City Department of Public Safety and Order, or DPOS, has apprehended 42 individuals, including several minors, over violation of the City Ordinance Number 2936, or the mandatory wearing of face masks in public places within the city. The violators are residents of Barangay Paltok, which is one of the areas in Quezon City with a high number of COVID-19 cases. According to Department of Public Safety and Order Head Retired General Elmo San Diego, the violators will face charges and penalty of 1,000 peso fine for the first offense. Second-time offenders will face a 3,000 peso fine and 5,000 peso for the third offense.
Yung iba hinuli natin dito, wala. Yung iba naman, improper.
The violators have their reasons.
Hindi ko po na dala yung face mask kasi bagong laba.
Akin po to.
Saan mo nilagay?
Sa bulsa po.
San Diego explained the improper way of wearing a face covering.
Pag kalahati lang ang maskara, kaya expose yung ilong mo, as good as no mask din yan. Nilagay mo sa baba, ganun din yun. Kailangan covered yung ilong at saka bibig natin.
The face mask must be worn right away after eating or drinking. Quezon City authorities continue to call on the public to take the ordinance seriously for their safety. Dante Amento, UNTV, News and Rescue. We serve the people. We give glory to God.
Meralco begins to process the refund for overestimated bills and installment schemes for its customers. The power distributor also reassures there will be no service disconnection until September. Here's why from Asher Kadapan Jr.
Nanay Marlene personally went to a Meralco business center in Quezon City today to ask for a refund. She explained that their electric bills from March to May, which her household had already paid, are way more than the cost of their regular consumption.
Imbis na pambili namin ng pagkain yung na iba, iniisip pa namin na mas unahin namin kasi mapuputulan kami. Ayun. Kaya binayaran namin yung sinasabi nila na estimated.
Marlene has recently received her June 2020 bill, which states the actual reading of their Meralco meter. It showed that she paid more than the estimated bill. But instead of getting the refund, she decided to use the credits for the next billing.
Pwede naman daw kukunin kong pera. Anyala, ang dami pang kung ano-anong ID na ibibigay ko, kung ano-ano, ay pangalan ng anak ko, hindi ko pangalan. Kaya, i-ano na lang para pang July.
Meralco advises customers looking to request for a refund to go to a corresponding Meralco branch office and make sure to bring the proof of payment of the Meralco bill and a government-issued ID. An authorization letter and a copy of an ID from the account holder will be required if a representative will go to the branch office.
Nag-provide tayo ng dedicated lane para sa kanila. So kung merong mga dumarating na customers ni Meralco para mag-refund, agad-agad pwede silang pumunta doon sa counter na yon sa dulo. At agad-agad sikasuhin siya ng ating customer care reps.
Meralco will also send to their customers a personalized explanation letter for the details and process of the refund. The notice will also explain the option of refunding their recently paid bills and pay through an installment scheme.
We would like to remind our customers na pwede nila i-avail yung installment scheme for those consuming 200 kilowatt hours and below based on their February 2020 bill their installment scheme will be 6 months, spread out through 6 months. For those who are consuming 201 kilowatt hours and above based on their February 2020 bill, yung installment scheme naman nila is spread out through 4 months.
Meralco reassures its customers there will be no service disconnection until September. Asher Kadapan Jr., UNTV News and Rescue. We serve the people, we give glory to God.
Meanwhile, some bicycle shops in Metro Manila are having a hard time procuring their supplies. Vincent Arboleda will tell us why.
With the high demand for bicycles nowadays, some bicycle shops in Metro Manila find it hard to meet customer demands. Marissa, who runs a bicycle shop which does wholesale and retail of bicycle units and merchandise, is having some trouble to meet all the demands from her resellers.
Sa mga wholesaler namin, bumibili, wala rin kami mabigay kasi sa tao pa lang dito kulang na.
According to Marissa, more than 100 units of bicycles arrive at her store weekly, but demand is so high that these units sell within 2 to 4 days. They also find it difficult to order a bigger number of units from their supplier.
Yung mga namin, yung kinukuha namin ng bike, mahirap din kasi ilabas sa sa pier, kaya medyo mahirap din sila magbigay sa amin ng piyesa ng bike, ganyan.
But despite the high demand for bicycles, there are other shops that experience slump in their sales.
Hindi katulad ng ECQ, medyo pag mababa pa yung bigayan. Matataas na rin.
Emily says the restart of public transport has affected their sales. Supply of new units is also a bit hard since the price of bicycles from their supplier has increased.
Dati nung ECQ, mga ilan nabibenta nito isang araw?
Mga 10, 15, ganyan.
Ngayon, ilan na lang?
Nasa 5 na lang pag sinert.
With the current limitations on public transport and the fear of being infected by the coronavirus disease, bicycles have become a great alternative for commuters going to their work or running errands. But with the current situation, bicycle riders are advised to observe health protocols and always be alert while on the road to avoid accidents. Vincent Arboleda, UNTV News and Rescue. We serve the people. We give glory to God.
The province of Palawan intensifies its campaign against dengue in its more than 300 component barangays. The campaign takes effect under a resolution of the local government created during their regular session last July 7. The resolution states that barangay captains, together with the barangay council, will lead the fight against the deadly disease transmitted by mosquitoes. The Provincial Health Office says that the rate of dengue cases dropped by 70% from January to May. This rate, which is equivalent to 182 cases, is lower compared with the cases from the same period last year, when cases reached as many as 800. The local government continues to monitor the health of the residents while carrying out its COVID-19 pandemic response to maintain the low number of dengue cases in the province of Palawan.
Malacanang allays the fears of the public on the China bubonic plague, according to presidential spokesperson Harry Roque. Though this is a serious issue, there is nothing to worry about because foreigners are still not allowed to enter the country except for those who are exempted from travel restrictions. This week, Chinese authorities have stepped up their precautionary measures after a confirmed case of bubonic plague in a city in the Inner Mongolia Autonomous Region. The bubonic plague was responsible for one of the deadliest epidemics in human history, the Black Death, which killed 50 million people across Africa, Asia, and Europe in the 14th century.
Well, siniseryoso po natin yan, pero wag po kayong mabahala kasi ang pagpasok po ng mga dayuhan naman sa Pilipinas ay hindi pa po pinapayagan ng malawakan, case-to-case basis lang po. So sarado pa po ang ating mga borders at wala pong dapat ikabahala.
The Intertropical Convergence Zone, or ITCZ, is affecting southern Mindanao. State Weather Bureau Pag-asa says this may cause cloudy skies with scattered rain showers and thunderstorms over Caraga, Davao Region, and Soc-Sargen. Meanwhile, Metro Manila and the rest of the country may experience partly cloudy to cloudy skies with isolated rain showers, mostly in the afternoon or evening due to easterlies or localized thunderstorms. Possible flash floods or landslides may occur during severe thunderstorms. No tropical cyclone advisory is issued.
Meanwhile, two House committees wrapped up the issues tackled during the past hearings on the renewal of ABS-CBN Corporation's franchise. One of our senior correspondents, Ray Pelayo, will tell us why.
After 12 hearings conducted by the House Committees on Legislative Franchise and the Good Government and Public Accountability, lawmakers presented the summation of all issues involving the renewal of the ABS-CBN franchise. Bayan Muna Representative Carlos Zarate cited the reasons why the franchise should be renewed, while the group opposed it was presented by Sagip Party List Representative and Deputy Speaker Rodante Marcoleta. There are also lawmakers that laid out their positions on the matter.
But I say, Mr. Chairman, that a yes vote to stop the franchise is a vote to stop perpetuation of an oligarchic state, an oligarchy that continue to suppress our people.
Thus, I implore my honorable colleagues to grant ABS-CBN a new franchise. Let us allow the company to partner with us in serving the Filipino people. Let us allow the company to correct its mistakes and hold them accountable should there be a clear finding of any violation of the relevant laws.
Issues tackled in the past hearings included the turnover of ABS-CBN to Lopez family after the EDSA revolution, the 50-year franchise limit, citizenship of Mr. Gavi Lopez, the issuance of Philippine depositary receipts, issues in labor, tax, and allegations of bias reporting. House Speaker Alan Peter Cayetano was also present in the hearing. The House leader clarified that the lawmakers are also busy not only on the ABS-CBN franchise issue but also in tackling other important matters, especially in responding the problem in COVID-19 pandemic. The House Speaker also raised other points.
So this is what we will have to decide. Totoo bang may isang korporasyon na prinoprotekta ng interes at ginagamit ang media para sabihin press freedom? Or totoo bang may mga nagagalit lang dahil tinatamaan sa news nila at objektibo po sila?
The Committee on Legislative Franchise is about to vote whether to grant the franchise or not in the following days. If it passed the committee level, it will be delivered at the plenary. Ray Pelayo, UNTV News and Rescue. We serve the people, we give glory to God.
And for the news abroad, here's Jovic Vermas live from London, United Kingdom. Good evening, Jovic. What have you got for us?
William, the UK reports that there have been 18,000 nurses and midwives who have joined the UK register since last year. Also, the British Finance Minister says he cannot promise that the 9 million furloughed employees could go back to their jobs. And in the USA, New Jersey residents will now have to wear masks in public places, even indoors.
Go ahead, Jovic, tell us why.
The United Kingdom has seen a significant increase in the number of nurses and midwives who have registered to work in the country, with 18,000 more than a year ago. According to the Nursing and Midwifery Council, or NMC, over 700,000 nurses, midwives, and nurse associates were on the register as of May 2020. This comes after UK hospitals and nursing homes managed to recruit professional nurses from the Philippines and India in particular. More than 14,000 nurses who retired and changed career had joined again the temporary register to help out during the pandemic, the NMC revealed. Despite this, there's still a growing concern the recruitment abilities and retention of overseas staff will be affected by the coronavirus. Although NMC Chief Executive Andrea Sutcliffe said it's great to celebrate record numbers of people on the register, she predicted there will be stormy waters ahead due to the pandemic and subsequent travel restrictions. Meanwhile, health workforce coming from Europe have dropped by 5% to just over 31,000. In a survey of more than 6,000 people prior to the coronavirus outbreak asking why they had left the profession, the NMC reports the main reason given was too much pressure leading to stress and poor mental health. Meanwhile, British Finance Minister Rishi Sunak said today he can promise that all 9 million furloughed employees could go back to their jobs after the announcement of a new bonus plan to retain staff amid unemployment crisis. Under the jobs retention bonus, employers will be paid £1,000 or $1,256 after the furlough scheme expires at the end of October for every worker who returns to their job, provided they are kept on through to the end of January 2021. The cost of the bonuses could be as much as £9.4 billion. Sunak also said that 1 million small businesses had accessed the Bounce Back Loan Scheme, which allows smaller companies impacted by the coronavirus to borrow between £2,000 and £50,000 to boost their finance. The world's sixth biggest economy shrunk by 25% in March and April and could be heading for its biggest drop in 300 years in 2020, with the unemployment rate on course to more than double to about 10%, according to official projections. Elsewhere in the USA, New Jersey Governor Phil Murphy said on Wednesday he would sign an executive order requiring people to wear face coverings outdoors. The order aims to prevent a resurgence of the novel coronavirus whenever social distancing is not possible. The order would be one of the most stringent coronavirus restrictions on public activity in the United States. Many states require use of masks in public indoor areas and recommend they be used outside. More than 15,000 people have died from COVID-19 in New Jersey, ranking it second after neighboring New York State in the total number of deaths, according to data.
I am proud that we were the first state to require face coverings in indoor businesses as we gradually reopen them. Given what we know about the behavior of this virus indoors, that was the right call from the get-go, and it has saved lives. And today's order reiterates our existing policy by requiring masks in indoor spaces accessible by the public, again with exceptions for those with medical conditions and those kids under 2 years old.
Let's now take a closer look at the updated count of novel coronavirus cases in countries worst hit by the world's common enemy at present. The USA now has over 3 million confirmed coronavirus cases, according to Johns Hopkins University CSSA COVID-19 report, with more than 953,000 recoveries. Brazil, country number in this tally, now has more than 1.1 million recoveries, surpassing the USA's count for survivors. Meanwhile, India has more than 767,000 confirmed coronavirus cases. India has the world's second largest population, much of which lives packed into cities, and 6 months after its first confirmed infection case, India has overtaken Russia to record the world's third largest caseload. Confirmed cases in India have been doubling every 20 days. Meanwhile, Hong Kong students studying in Australia now have a pathway to permanent residency as China imposes a new security law on the city. Australia Prime Minister Scott Morrison said at a news conference in Canberra that Australia will be extending visas by 5 years from today for skilled and graduate visa holders. About 10,000 Hong Kong citizens or residents are in Australia currently on student visas or on temporary work visas. The move comes after Britain had previously extended visa rights to some Hong Kong citizens.
What we've agreed to do is we've agreed to adjust the policy settings to ensure that for skilled and graduate visa holders, we'll be extending visas by 5 years from today, with a pathway to permanent residency at the end of those 5 years. Now that means if you're a current or future student, you'll be able to stay for a total of 5 years once you've graduated, with a pathway to permanent residency at the end of that period.
Also in Australia, its second most populous state, Victoria, will relax restrictions, and many of the 3,000 people held in a complete lockdown since Saturday. That is despite surging numbers of COVID-19 cases, State Premier Daniel Andrews said today. Andrews said that after testing all 3,000 people in the towers, residents in 8 high-rise buildings will be allowed to leave their homes for essential reasons. The same rules enforced throughout the state. The relaxation of the rules will be a relief to residents, many of whom have said they have been left without sufficient food and supplies. And those are the reasons behind the news here in the United Kingdom and in other parts of the globe. Back to you, William.
Thank you, Jovic. You stay safe there in London.
Locals in Kenya's Rift Valley used to travel more than 60 kilometers to the nearest towns for an internet connection. But that has changed. And the answer is up in the sky. Nina Armilio has the story why.
Villagers in remote regions of Kenya's Rift Valley now have access to the world's first commercial high-speed internet using balloons.
Where we have a digital gap in this new post-COVID era, it must be closed. So we are proud to be closing that gap.
The project, offered by Alphabet Inc., aims to provide affordable 4th generation or 4G internet to undercovered or uncovered rural communities and has been more than a decade in development. The service is run by Loon, a unit of Google's parent Alphabet, and Telecom Kenya, the East African nation's 3rd largest telecoms operator.
We want the rest of Africa to join us, creating a single digital market so that our 1.3 billion Africans can also all be connected.
According to Loon, the airborne base stations have a much wider coverage, about 100 times the area of a traditional cell phone tower. Nina Armilio, UNTV, News and Rescue. We serve the people. We give glory to God.
A local diner in Los Angeles, California takes the extra step to make people feel extra comfortable while dining. Diners say it's an amazing experience dining out here. Beverly Saison has the story why.
This spot in Los Angeles used to be a parking lot, but now it has individual greenhouse pods for dining. With social distancing measures in place, diners could still enjoy meals outdoors while feeling safe. The restaurant has turned its expansive outdoor space into a garden filled with flowers, herbs, and plants, where private glass cabins have been installed.
I think this is amazing. This is what I think we have needed for a real long time, and merging that safety plus still experiencing social interaction. Very safe.
Resto owner Misty Manzuri said the pods are cleaned and sanitized after each use and comply with coronavirus guidelines issued by the U.S. Centers for Disease Control and Prevention. Manzuri was inspired by images of similar dining spaces in Europe.
The CDC guidelines are really you just have to be 6 feet apart, right? I just went the extra step to make sure that people feel extra comfortable.
California Governor Gavin Newsom has put a temporary ban on indoor dining in most of the states as COVID-19 infections surge, but dining outside is still allowed. Beverly Saison, UNTV, News and Rescue. We serve the people. We give glory to God.
And those are the reasons behind the news, July 9, 2020. I'm Angelo Castro III. We serve the people, we give glory to God.
And I am William Theo. Because we need to know, we will always ask why. Have a great evening, everyone.